All right, let's jump right in. Today, we're building a practical, hands-on playbook for what can be one of the most challenging areas in pharmacy, managing patients with schizophrenia and other psychotic disorders. This is all about giving you the tools and the confidence you need to make a real difference for these patients.
So, picture this. It's a busy Tuesday, and a new script for an antipsychotic hits your queue. You've got an anxious patient, maybe an overwhelmed family member standing there. In that moment, what are the absolute most critical things that need to be firing in your brain to handle this well? That's the core question we're tackling today. And here's our game plan. We've broken it down into a 5-step playbook. First, we'll get into the why, understanding psychosis. Then, what's the mission, our goals of therapy. We'll dive into the drugs themselves, create a watch list for side effects, and then pull it all together with counseling that actually works. Let's get to it.
Okay, section 1. Before we can even think about the medication, we have to understand the condition. This is all about grasping the why behind that prescription in your hand. It's the foundation for everything else we do.
So, what is psychosis, really? At its heart, it's a brain disorder. It causes a fundamental break with reality. And think about how profound that is. It affects a person's ability to think, to feel, to perceive the world around them. This isn't a personality issue, it's a serious medical condition. And the symptoms come in 3 flavors. We all know the positive ones, the things that are added to a person's experience, like hallucinations. But honestly, it's often the negative symptoms that are more devastating. Things that are taken away, like motivation, joy, social connection. And when you layer on the cognitive problems, like trouble with memory and focus, you start to see just how completely this can impact a person's life.
And this is not some rare, obscure disorder. About 3% of people worldwide will experience psychosis at some point. That's a huge number. It means you are guaranteed to encounter these patients in your pharmacy, and your expertise is absolutely critical.
Okay, so now that we have a better feel for what the patient is going through, what's our mission? What are we actually trying to accomplish with treatment? That brings us to section 2, the goals of therapy.
And the goals are so much bigger than just stopping the voices. We're aiming for full remission across all those symptom types we just talked about. But just as important is prevention. We're trying to prevent relapse, prevent suicide, and prevent all the physical health problems that can come along with these medications, like metabolic syndrome. Ultimately, it's about preventing harm and helping someone get their life back.
All right, let's get into the pharmacology. Section 3 is our deep dive into the pharmacist's toolkit, navigating the antipsychotics themselves.
You can really think of this as a tale of 2 generations. The first-gen drugs, the FGAs, are powerful D2 blockers. They work, no doubt, but that raw power comes at a cost, a much higher risk of those really difficult movement side effects we call EPS. The second-gen drugs, the SGAs, are a bit more sophisticated. They also hit serotonin receptors, which generally gives them a better side effect profile. And that's exactly why they are our first-line choice most of the time.
Now, this table is your secret weapon for predicting side effects. So much of what we see is from off-target effects. So, when a script for olanzapine comes in, your brain should immediately connect it to H1 blockade and think sedation and weight gain. A script for clozapine, you should be thinking M1 blockade and be ready to counsel on dry mouth and constipation. This is how you get ahead of problems before they start.
Now listen up, because this is a huge practice changer. Long-acting injectables, or LAIs, are not just a last resort for patients who are non-compliant. That's old thinking. Today's guidelines are crystal clear. We should be offering LAIs as an option for everyone, right from the very first episode. This is a total paradigm shift that can dramatically improve adherence and prevent relapses. And that brings us perfectly to our 4th section, monitoring key side effects. I want you to think of this as your personal watch list, your active surveillance program for keeping patients safe and adherent to their therapy. And why is this so important? Because of this right here. Side effects aren't just an inconvenience. They are the single #1 reason patients stop taking their medication, full stop. And when they stop their medication, they relapse. So your role in managing side effects is absolutely central to keeping people out of the hospital.
So what do patients themselves say are the toughest side effects to live with? Well, it might not be what you think. Look at this. Topping the list are things like sedation, weight gain, and that horrible internal restlessness called akathisia. This tells us exactly where we need to focus our counseling to have the biggest impact.
So let's get really practical. For metabolic syndrome, which is a major concern with SGAs, the monitoring is spelled out for us. When you're dispensing that new prescription, are you already thinking about that 12-week mark? Are you making a note to check if fasting glucose and lipids have been done? This is a perfect chance for pharmacists to step in and make sure these critical safety checks aren't missed.
Now for your movement disorder watch list. It's all about pattern recognition. If a patient says they feel like they're crawling out of their skin and just can't sit still, that's akathisia. Beta blockers are the answer there. If they suddenly have a painful muscle spasm, especially in their neck or jaw, that's acute dystonia, a true medical emergency. Knowing these differences is absolutely vital.
Okay, knowing all the clinical details is one thing, but communicating it effectively to a patient, that's where the magic happens. And that brings us to our final section, Essential Patient Counseling, where we put all this knowledge into practice.
Here's a simple 3-step framework you can use every time. 1. Set expectations. Let them know this isn't an overnight fix. It takes 4 to 6 weeks to really see the benefits. 2. Talk about side effects proactively, not as a scary list of warnings, but as a manageable plan. This might make you tired, so let's try taking it at bedtime. 3. Connect the dots. Make it crystal clear that taking this medication every day is the most powerful thing they can do to stay well.
And here is a clinical pearl that you absolutely cannot forget. Always, always ask about smoking, especially if your patient is on clozapine or olanzapine. The stuff in tobacco smoke literally revs up the enzymes that chew through these drugs. So if a patient quits smoking in the hospital, their drug levels can shoot up. If they start smoking again at home, their levels can plummet, leading to relapse. This is a huge safety issue.
And if you need one single statistic to hammer home the importance of adherence, this is it. Patients who stop their medication are 5 times more likely to relapse. 5 times. That's a staggering number, and it really shows you what's at stake every time you have one of these counseling conversations. And this quote explains why preventing relapse is so incredibly important. There's this concept called kindling. With each psychotic episode, it can take longer for the brain to recover, and sometimes the recovery isn't as complete. They might not get back to their previous baseline. So when we prevent a relapse, we're not just preventing a hospital stay, we're protecting the brain and preserving their future.
So let's boil this entire playbook down to 3 key takeaways. 1. SGAs are usually the first choice, but you have to be the watchdog for those metabolic side effects. 2. Counsel proactively. Turning a side effect from a warning into a plan is your superpower. And 3. Be a champion for adherence. Remember that LAIs are a fantastic tool and they're a first-line option.
I'll leave you with this one final question to think about in your own practice. How can you, personally, transform that conversation about side effects? How can you shift it from just a list of warnings into a collaborative, hopeful plan for success that you built with your patient? Getting that right can change absolutely everything. Thanks for joining me.